Namaste and good afternoon. Greetings from all of us at Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I am very happy to see you all again. Today is World Sickle Cell Day. This is observed all over the world to raise awareness of sickle cell disease, its care, its prevention, and also to create the awareness about the latest treatments available. Sickle cell disease is something that affects millions of people throughout the world, and it is particularly common in certain parts of the world, particularly sub-Saharan Africa, Spanish-speaking regions, the Mediterranean, Middle East, and even in India among certain communities. It is an inherited blood disorder where, the sickle-shaped red blood cells are there instead of the normal, round, and flexible ones. So they stick together, blocking blood flow and oxygen from reaching all organs in the body, and it can cause several complications. You know that Apollo Hospitals has always been at the forefront of creating health awareness, and with our numerous Facebook Live sessions especially, we have been bringing to you very authentic information straight from the experts. So it is very apt that today we shine the light on sickle cell and learn about the latest treatments for sickle cell disease, such as gene therapy and stem cell transplant, from a top expert in this field, Dr. Padmaja Lokireddy. Dr. Padmaja Lokireddy is a well-known hematologist and bone marrow transplant consultant at the Apollo Cancer Institute, Hyderabad. She's an MD and MRCP and FRCP in hematology. She has won numerous awards, such as the Brand Icon Award 2020 for Healthcare Excellence in Haemato-Oncology, as well as bone marrow transplant from the International Biographical Center, Cambridge, and has also been included in the International Biographical Dictionary, Cambridge, and is recognized as one of the top 100 physicians in 2016. She's also worked as hematology and transplant consultant at different university hospitals like Glasgow, Birmingham, and has been a visiting consultant at the Johns Hopkins Institute, US as well. Her recent work includes transplant and CAR T-cell therapy at the Manchester Royal Infirmary, and is actively trying to bring this treatment to India by forming international collaborations. And in fact, she is the first doctor in India to have the clinical work experience in CAR T-cell therapy. Welcome, Dr. Padmaja Lokireddy, to this Facebook session. Thank you so much for joining us here. And we'd love to hear all about sickle cell disease and especially about the latest treatment options for it.
Thank you, Dr. Srinidhi, for a lovely introduction. Thank you.
So let's begin by, just a bit about the basics itself on exactly what is, the sickle cell disease, and we often hear about the sickle cell trait as well. So could you explain about that to us?
So as we said, sickle cell is the meaning the red cell is changed into a sickling shape. It is an inherited hemoglobin problem. So when you have got an alteration in one of the amino acid in the beta chain in the hemoglobin, the production changes. And whenever there is less amount of oxygen, the sickle changes. That normally the red cell is nice and round shape. So it's nice and flexible to flow through the blood into a small blood vessels. But whenever there is less oxygen, with this medical problem in the sickling, the red cell will become into a sickle shape. So it becomes less, flexible, and it blocks the small blood vessels when it is flowing through. So when we say sickle cell disease, that means they are having a clinical problem where they are having a defective of two genes. Every person will inherit half of the genes from mother, half from the father. So when we have two faulty genes, you get a disease. If you've got only one faulty gene, then you become a carrier, but you don't suffer from the disease, but you have an ability to transfer it into your next generation. But it's only by 50% if you're a carrier. So just to give a little bit of clearance, if you're a person who is carrying the gene, that is, you're not diseased, if your partner, your husband is completely normal, you will not have a child with a sickle cell disease. That is, you will not have a child with a clinical problem. you may pass the gene as a carrier to 50% of them. So the disease meaning to say that you have got two faulty genes. If you've got one faulty gene, you're called a carrier or a trait. But if you've got two faulty genes, there is a sickle cell disease is a spectrum. You may have two faulty sickle genes. It is called sickle cell anemia. Or you may have one faulty sickle gene, but the other half of the beta chain may have a thalassemia. Then you still have a sickle cell disease. So when you have a normal one with one sickle, you don't have a problem. You call it as a trait or a carrier. But half of the gene you got it from your one parent is a thalassemia carrier and one is a sickle carrier. Both joined together, they form a major problem. This is called sickle beta thalassemia. It is also called a sickle cell disease. So when two genes have a problem, there is a clinical issue. That's what is the difference.
So what are so you just explained about the spectrum, but what are the causes? Why does this genetic condition happen? Are there any risk factors?
Historically speaking, if we look at paleontology and all the things, how this sickle has come, a while ago, malaria was very rampant. At that time, especially in African countries, malaria was very rampant and people were dying. So it's a natural selection. The nature has done what it has done is to make the cells into a sickle shape. So malaria couldn't survive, but by default, people developed a sickle cell anemia. So it's an inherited problem which has acquired over a number of years over a natural selection, but now it is passed on from one generation to the other. If you don't have a family history of the sickle gene at all, whether it's detected or undetected, you don't actually get a sickle cell anemia just out of shell. It has to be an inherited problem.
So what?
No exposure to environment or carcinogen or anything of this sort will cause a sickle. No stress, nothing of that sort. It has to be genetic. Whether parents are diagnosed, whether they were carriers, you may not have known and you may be diagnosed. So that's what it is. Yeah.
So again, like you were talking about a range of symptoms or no symptoms at all in this condition. So what would be the common symptoms, and also what would prompt somebody, because I mean, supposing somebody wants to, seek medical advice, what would be the earliest symptoms of this condition?
That's a great question, Srinidhi. So clinical symptoms, how they present usually is a painful crisis, especially during childhood. People having a severe, joint pains or a small fingers or toes pain. This is called dactylitis. That means these sickle blood cells are gone into a small blood vessels and they blocked up the circulation. That's why people get severe pains. So if they're getting severe pains with no cause, one should do a blood test. That is a simple blood test called a CBC, where you look at the hemoglobin parameters, and also a test called a hemoglobin electrophoresis, where you're looking at the type of hemoglobins. Normally, in an adult, you will have a hemoglobin A. There is a small percentage of A2 and a fetal hemoglobin, but you do not have any hemoglobin S, that is sickle hemoglobin. But somebody who is a carrier, in that particular blood test, you will see hemoglobin S levels about 20%, 30%. But if you're seeing hemoglobin S levels more than 60% or 50%, they got to be a sickle cell disease, and they may have a clinical symptoms. Generally, sickle cell with a 30%, 20%, you do not have any symptoms. That is what is a trait. When you have a higher numbers, there you have a tendency for the blood vessels to be blocked. So you will have a severe pains in the joints, or what we call as a chest crisis. It's called a painful crisis, where people have an acute episodes of pain. And these pain can range from a very minor, where you can just settle with a paracetamol, to a very severe, where you're needing higher painkillers like diclofenac, hyphenac, and tramadol, or, admission to settle it. To a severe extent, you may need a morphine injections. Luckily, in Indian, whatever we have seen, they're not that severe painful types. What you would see in sub-Saharan Africa, and a lot of sickle patients you see in UK who have come from Africa, sometimes they get admitted to have high doses of morphine. And we don't see that phenomenon much in India. People have got a painful crisis, but manageable most of the time as an outpatient with painkillers. So we're, in one way, we're a little bit lucky that we do not have that subtype of a severe painful crisis. But we also have symptoms like anemia, like drop in hemoglobin. Sometimes they break the hemoglobin because these cells are altered in shape. So they break off and they cause a bit of jaundice, though they always have a little bit of raised bilirubin in the blood test, and they have a low hemoglobin. But generally, they're not transfusion dependent unless you've got associated thalassemia. And people may have a little bit of a spleen if they have associated thalassemia, but generally they don't have a spleen. So painful crisis is the biggest thing. And the second common thing is people can have anemia and needing blood transfusions, jaundice. But on a long term, if you see an adult, sometimes they come with the bone pains, joint has got been damaged, like somebody in 30s, 20s, teenagers, you're coming with some hip pains. It is called avascular necrosis of hip because of these small blood vessels being blocked in an area of blood vessels in the hip. They get a damage to the joints, and some people go on joint replacements. And there is a new therapies for the cartilage repair, regrow. There are a lot of other things. So, and also one thing, they should look at a kidney damage, look at a protein loss in the urine, especially in 40s for a sickle. But a younger patients start looking at how to control their pain and things. So, yeah.
Yeah, you mentioned India, so I just wanted to ask you, how prevalent is sickle disease in India? Is it as prevalent as the Africas and some of the other Middle East and other places where it's known to be quite prevalent?
So in the world, if you take about 75% of sickles is all in Africa. What we have is much less. About 5% are carriers if you look at, and it's all in clusters. The incidence is not the same. It is in clusters, certain areas where they marry within the groups. Adilabad, in some areas, it is much higher. Like people in Assam, they have a hemoglobin E in association with S, they have a problems. So it's important to see if there is a family history or somebody known in their family, one should go for testing for this particular condition.
That is what
blood test.
Yeah. So about the prevention of sickle cell anemia, then is the only way is to get tested before you get married. Is that the only way?
I think it is a good thing if somebody in the family has it. They should let other people know so they can check themselves. Somebody, youngster, teenager who's planning to marry, if they want to know about their condition, they've had some anemia or pains, they should check CBC and a blood test called hemoglobin electrophoresis. If their test is completely normal, they don't have to worry about their partners, because even if the partner is a carrier, nothing is going to happen. So if they happen to be a carrier, they should make sure their partner whom they're going to marry should be tested for. It doesn't mean that you can't marry, you can marry, but you should go for a genetic counseling and see how you want to plan for, because there is a 25% chance that you could have a completely a normal baby, even if you and your partner are a carrier. But you probably have to go through IVF and choose the baby who don't have it. If you, that's all comes in the genetic counseling. So there are lots of ways you can do, but as long as you're aware of this.
So I think now we'll move on to the treatment options for sickle cell disease. So what are the major treatment options, and is transplant something that, we'll come to the gene therapy in a bit, but what are the treatment options, and is transplant something that everybody can undergo?
So always prevention is good. We want the governments to do a screening programs for every antenatal to look for all these. And once you've got it, making sure that you don't have a painful crisis. So identifying how to prevent a painful crisis, like treat infection immediately, prevent dehydration, keep yourself well hydrated. And whenever there is a pain, start treatment much quicker. Those are management of these complications. And keep oxygen. Whenever you have a painful crisis, you should have fluids, oxygen, painkillers, and if you need antibiotics immediately. And sometimes these painful crises are so bad, they're admitted in the hospital with like something called a chest crisis, or sometimes they can get strokes because this happen in the brain. And those times we do some procedure called red cell exchange. So we shift out all their red cells and give a new ones. If you start doing by giving blood, you make the blood too thick. So we do this on a machine called apheresis machine, where we can give about one blood volume we can change. So we give about 8 bags or 6 bags according to the patient's weight, and we safely take out the patients and then give a new one. So you're diluting out your hemoglobin S levels. You bring them down from 80% right down to 20%, make them, sickle free. And the pains and everything will settle down very quickly. So if you've got a major life-threatening issue, that's what we would do in the hospitals. So one is a simple measures treating this. And how do we cure from this? The cure is only by bone marrow transplant until recently. And now the new therapies of gene therapy is coming up. Again, bone marrow transplant, not everybody can have it. We want to do it in a younger patients. We don't want to wait for the transplant until the complications set in. And so far, the sickle transplants, we like to do it in sibling matches. So suppose your brother and sister, if they are a match. So for audience, match is a white cell match, what we call as a HLA match. So all of us have got a blood group like A, B, O. Like that, we all have a white cell typing. It is quite a bigger denominator when we look at it. But all the siblings, there are 25% of them are going to be a full match. So you get half from your father, half from your mother. So about a one-fourth chance that you could be a full match between the siblings. If it is the case, we go straight off for bone marrow transplant, which is a curative approach. But if there is no match, we don't do half match transplants now, because sickle is a benign condition. It's not a cancer. The complications we don't want to take because there could be a risk of mortality. The next new treatment is a gene therapy. Gene therapy is so amazing that you can deliver this therapy at any age, even for a 30-year-old. Transplants, we tend to restrict it for people below 20 years so that they have a less number of complications. In gene therapy, what we do is we wipe out all the stem cells. We collect the stem cells first, and we modify wherever there is a particular problem, we modify this particular gene by doing a viral vector. It's all done outside the body in vitro. In a laboratory, we collect the stem cells, we modify them, put the new gene into it through a viral vector, and we give a chemotherapy to wipe out whatever the existing ones and give these new stem cells back into you. It appears a little bit like a transplant, but it's like your own cells which are genetically modified. And this is a potential cure. And the chemo what we give is a very smaller amount of chemotherapy when we do gene therapy, and it is tolerable even for an older age group. And we don't give immunosuppression because it's your own cells. You don't have concerns about rejection, graft versus host disease. Whole lot of complications what we have in transplant don't occur in gene therapy. So that's the beauty of it. Of course, it has got few of the other risks, but as the time is going through with a CAR T cell therapy, gene therapy, they're all following the similar lines of treatments. So we're getting better and better at it.
One has also heard that, sickle cell disease is very ideal for gene therapy because it is a single gene mutation. So is it now prevalently done in India? Like, do we do this gene therapy for a lot?
Gene therapy is not available in India. As I said, I've recently worked in Manchester as a CAR T consultant. So from July to December last year, that is not long ago. And we were just counseling 1 or 2 patients to start in the clinical trial. So even in the most advanced countries, gene therapy is just beginning in real life setting. So but it is going to take
hope, isn't it? I mean, it sounds so exciting. And I mean,
it is, yeah. So it's going to be a reality very soon, very soon. It's going to be a reality. Even in India, things will just come on within the next 3-4 years.
So you were saying that this gene therapy can have, are there any, first of all, is there, you said that even older people can have it, but who are the best candidates for gene therapy, or just about any age group or any severity can undergo it?
So again, any new therapy comes, we don't have a long-term data, whether this gene therapy is going to last for longer or whether these cells are going to stay for a few years and whether they're going to be lost and then the sickle cell disease will come back. All these questions are there. As the time goes, we'll have answers for it. But the short term in the results in a clinical trials, it's appearing good. Like transplant, we know once it's done, it's for life. If you cross about 2 years after the transplant, 5 years, we say it's cured, and you don't lose the donor after 5 years. But in gene therapy, there is a little concern whether they will revert back to the full sickle cell disease after a few years, whether these cells will decay. All these questions are there. And there are a few complications with giving T cells like cytokine release syndrome, all that, but things will get better. But how we choose the patients, I think the first line is still going to be a transplant for patients who have a sibling, but people who don't have a sibling, who are younger, who are going through a lot of complications, like they're having a multiple painful crisis, prolonged hospital admissions, or a neurological problems like they're developing strokes, or they have a family history. Sometimes you hear in sickle families, there are 3 deaths, sudden deaths. Those are the patients you identify, a high risk group, and then put them through a transplant. If they don't have that option, then yes, gene therapy.
Is there anything else that you would like to add, Dr. Padmaja?
I think most important thing is awareness about sickle, and knowing and diagnosing it when people have got a severe painful, especially in children, because it could be treated as arthritis. Misdiagnosis is quite common. Identifying that, making sure patient education, being aware what is a painful crisis, how to prevent it, and learning all about it, and taking ownership of that, and preventing any bone damage, so you don't come for joint replacements and other things, and making your bone health. Continue good exercise. Don't keep up yourself in the house just because you have a sickle. You need to keep up your muscle strength, develop and do some exercises what are important to improve your muscle strength. And of course, seek for curative options whenever you have a severe crisis. But to buy the time, red cell exchange is a very ideal thing in patients who are going through multiple complications. And gene therapy, I hope that it'll be available for all of us very soon and could cure this disease.
Absolutely. Thank you, Dr. Padmaja Lokireddy, for this very illuminating discussion. And dear viewers, I hope that you all found this useful. I don't intend to let sickle cell keep me from doing the things that I love to do, that makes me who I am. You can call that stubborn, but I just call it living. This is a quote from a sickle cell disease survivor. So let us be inspired by such messages of hope and courage, and aim to work together as a community, not only to spread awareness about the many phases of sickle cell disease, but also hope that these revolutionary treatments are going to come and save lives and make quality of lives better very, very soon. If you have any more queries, you can always reach out to us on our social media channels. Viewers, take care. See you soon. Thank you and namaste.